This is actually pre and post treatment results of functional eye movements in an 18-year-old male with autism who underwent 12 weeks of therapy in our clinic. He was also given a home program to do specific exercises at home. And this functional eye movements, when we measure this, is a really cool way to look at the brain because all these different eye movements are controlled by different lobes of the brain, essentially. So you got fixations, which are controlled by the brainstem. This is where primitive reflexes emerge from. Pursuits are controlled by the cerebellum, which is balance and coordination typically, and the parietal lobe, which is more sensory processing. And then finally you have saccades, which are controlled by both the cerebellum and the frontal lobe, which the frontal lobe is responsible for executive function, cognitive function, and also more advanced emotional regulation. And the results in this case was really significant. As you can see, big improvement in all the functional eye movements, which tells me that we improve functional connectivity between these regions of the brain. And the cool thing about improving functional connectivity is that you're changing how the brain is wired. So these are going to be long-term changes for these kids. Not only do we see it on paper, but his mom reported that while he was just started community college, he was too anxious to go to school and drive himself. Now he's driving himself. He's starting to make friends, interacting with his peer groups, better social engagement. And so these are life-changing type of improvements, which makes me really happy to be able to be part of.